Why did you choose trauma? Why did you choose this field, Dr. Avi?
I will tell you.
नबिलको हरेक खातासँग सफलताको गाथा जोडिएको छ। देशमै पसिना बगाउँछु भन्नेहरूको स्वाभिमानमा मौलिकता जोडिएको छ। नबिल बैंक केवल एउटा बैंक मात्र नभई तपाईको परिवारको हिस्सा बन्न पाउँदा हामी कृतज्ञ छौं। नबिल बैंक, सँगै अघि।
Do you remember your father when you were 15? You were 15, right?
15
years old. Do you remember the stories that your father shared?
No stories.
No stories.
No stories.
Nothing.
Nothing. Nothing. They don't speak about it. That the child will grow normal. That the child will be not, his soul will not be affected.
Yeah.
What can we do? They were closed. They didn't spoke about it. You know, from time to time, I heard the story, not from my father, I heard it from my mother. He didn't spoke about it.
No parent wants to tell their kid about the traumas of life.
No. Especially the Holocaust survivors. It's a well-known subject, well-known problem, well-known, you know, I'm not the only one that nobody spoke with him.
Yes, Doctor.
It's a very common. They didn't spoke about it. They want to live so-called the new life in Israel, and that the next generation will not be affected at all.
At all.
At all.
Dr. Avi, there's a count, by your own count, if I'm not mistaken, where you have treated more than 10,000 victims of bombings, war, traffic accidents, tsunamis, earthquakes, natural disasters. Is this true?
Looks to me that more than 10,000.
More than 10,000?
For sure. For sure. Well,
why did you choose trauma? Why did you choose this field, Dr. Avi?
I will tell you. When I was a resident, first of all, I'm general surgeon, and I was sure that I will be general surgeon since my 5th year of medical education. There was not even differential diagnosis what's going on with me. I was sure. I work as a nurse, so-called, in the emergency department, and I was in love with the general surgeons.
Yeah.
And the nurses like me, so they let me in to the ORs. So I would finish my duties after 8 hours, and then immediately I went to the ORs, spend their hours to see what they're doing. So I was sure that I'm going to be a surgeon.
Yeah.
That's one. The second, what happened, we had a woman came to the emergency room. She was beaten by her husband. She came, she complained of some abdominal pain, and nobody, there was nothing to write home about it, so-called, and they sent him home.
Sent her home.
Sent her home. After a couple of hours or one day, she came back, and she said, listen, I have still abdominal pain. I'm not happy. So, the tendency was, keep here. They left him on a bed. And in the morning, they find her dead.
What was the cause?
Looking retrospectively in our morbidity and mortality conference. I remember it like it was yesterday. And I remember the surgeon that was in charge. And I remember the nurse. And I remember everything. And it was discussed in our morbidity and mortality conference. And we came to the conclusion that is a preventable death. You know, in trauma, you have preventable, unpreventable, and potentially preventable death. So that was declared preventable death because she bled from injury to the spleen.
In the spleen.
Yes.
For 2 days.
For 2 days, small injury. She bled slowly, unfortunately but surely, to death. All the hospital, and I personally, I was in state of shock after I understood what's going on. Mm-hmm. And I came to my boss and I told him, listen, I want to deal with these diseases. I want to deal with trauma. I'm not happy with what happened.
Yeah.
It will never happen again. I want to deal with this disease. It's a disease. You know, spleen, it's a part of the body. However, it was caused by trauma. Today, it's the husband. Tomorrow, it's a road accident. After tomorrow is a terror attack. And today, let's say in our days, I don't believe, I hope that people are dying from splenic injury. Only splenic trauma. I want to believe. Let's say in Hadassah in Jerusalem,
yeah,
I can give you the data. We are keeping everything. It's written, etc. I don't remember that somebody bled from
the spleen
and died. No way.
There's a data that we have, doctor, that I want to share with you.
Okay.
7 people out. Nepal has 7 health workers per 10,000 people. Most ambulances have no medic, just a driver, and patients reach the ER by taxi. We're talking about here. You gave me a solid example earlier. I would love it if we could share that in a while. You built Israel's first trauma unit practically from zero, if I'm not mistaken.
From -0.
From the -0. What suggestions do you have?
Listen, our story is really, it's what I said is trauma against all odds.
Trauma against all odds.
Yes. That's what happened in Israel in my hospital. Everybody was against the trauma unit. Everybody.
Which year was this, doctor?
1990. Let's start from 1990, 1992, etc. Okay?
You graduated in 1973 and in 1980?
No, I graduated in 1980. 80. I started my residency in 1980.
Yes.
I spent it's 6 or 7 years residency, and then I went to Baltimore, Maryland. Shock trauma unit, supposed to be the best trauma unit in the world. And I was accepted there. And I built my career according to what I was there 2.5 years. I will tell you.
Yes.
The main idea is that I was very happy in Baltimore, very, very happy in Baltimore. My director general from the hospital came to visit me in Baltimore, and he saw everything.
Yeah.
He told me, listen, Avi, don't come back. That's why I told you, trauma against all odds. He told me, they love you here. I spoke with them. They admire what you are doing. You're talented surgeon. They love you. Stay there. Don't come back to Jerusalem. There will not be, never, ever, a trauma unit in Hadassah in Jerusalem.
They wanted you to stay at the at Maryland,
Yes.
at the university.
Yes.
In Baltimore.
In Baltimore.